Hello to all the aunts, uncles, and elder brothers and sisters, those who have lived through more than half a lifetime filled with hard work, sacrifice, and experience. I'm making this video not to talk about something grand. I want to share something small. Yet it causes so many of us to wake up in the middle of the night in pain, to clutch our calves from cramps that feel like someone's squeezing them tight, and to grit our teeth and endure it without knowing why it keeps happening. I'm talking about leg cramps in older adults. How many times have you been in deep sleep, only to suddenly wake up in pain from your calf to your toes, muscles stiff and cramped? 1. What are leg cramps and why do they happen more often with age? Leg cramps, or sudden muscle spasms, often in the calves, feet, or even toes, are sharp muscle pains that come on suddenly and last from a few seconds to a few minutes. After age 60, changes in hormones, circulation, nutrition, and muscle function all contribute to a higher risk of cramps. Decreased circulation, reduced blood flow to the muscles, especially during sleep or after long walks. Mineral deficiencies. Older adults often absorb nutrients less effectively and eat less, leading to deficiencies in calcium, magnesium, potassium, and sodium, all of which help regulate muscle function. Multiple medications, calcium channel blockers, statins, anti-inflammatories, and others can contribute to cramping. Weakened neuromuscular system. Muscles become less flexible and nerve responses slow down. Although it may seem minor, frequent cramps that wake you up at night, stiffen your legs, and cause lingering pain can lead to fear of movement, mental distress, disrupted routines, and eventually chronic fatigue and insomnia. 2. Why understanding the cause matters. Don't ignore it. Many people believe leg cramps are just a part of getting old or something trivial. But failing to address them properly can mean overlooking serious underlying issues. Persistent or severe cramps may result from major electrolyte imbalances or be signs of conditions like heart failure, liver disease, diabetes, or vascular disorders, which can lead to complications if untreated. If cramps occur in only one leg, especially with swelling and worsening pain while walking, it could indicate deep vein thrombosis, DVT, a medical emergency. Cramps that occur while walking and ease with rest, especially in people with a history of high blood pressure, diabetes, or smoking, may signal peripheral artery disease, PAD, which, if not treated, could lead to limb loss. Rare causes like cancer, liver disease, e.g., cirrhosis, autoimmune disorders, or spinal stenosis have also been linked to cramps. If you've ruled out common causes but symptoms persist, further medical evaluation is essential. 3. Prioritize a step-by-step approach, from simple to specialized. The good news is that leg cramps can often be managed through simple changes in lifestyle, diet, and movement before considering advanced medical treatment. Here's a 3-step roadmap. Step 1. Adjust nutrition and electrolytes. Don't worry too much about cutting out salt entirely. Instead, maintain healthy sodium levels for proper muscle function. Add key minerals like magnesium, prevents spasms, potassium, aids nerve signals, calcium, regulates contraction and relaxation, and arachidonic acid, helps calcium enter muscle cells. Step 2. Increase gentle, consistent movement. Take light walks daily, stretch your leg muscles, rotate your ankles, and stretch tendons. Just a few minutes of these daily can improve flexibility and reduce sudden cramps. Step 3. Seek medical evaluation if there's no improvement. 4. Medication side effects. Older adults often take multiple medications. Some of them can trigger cramps, without people realizing it. Common culprits include statins, cholesterol drugs may cause muscle pain, cramps. Diuretics, blood pressure meds deplete potassium and sodium. Osteoporosis meds, like Forteo, Avista. NSAIDs, painkillers such as ibuprofen, naproxen. Antibiotics ciprofloxacin can damage muscles/tendons. SSRIs, antidepressants like Celexa, may disrupt electrolyte balance. What to do if you suspect your meds cause cramps? Record your symptoms. When do they occur? After taking which med? Talk directly to your doctor. Ask about switching meds or adjusting the dose. Never stop taking medication without professional advice. Green circle in the next section, I'll cover the remaining 3 causes, including more serious conditions like blood clots, arterial blockages, and deeper issues like cancer, liver disease, or spinal stenosis. But before we go there, you can note down the first 4 causes and check if any apply to you. Share this video with friends or loved ones. It's a common issue many silently suffer from without knowing how to fix it. Subscribe to the channel if you found this helpful, so I can continue offering simple, practical health tips for aging well, right from home. 5. Deep vein thrombosis, DVT, the silent blood clot. Have you ever had cramps in just one leg, where walking makes the pain worse, and even resting doesn't completely relieve it, accompanied by swelling or warmth in your calf? That could be a sign of deep vein thrombosis, DVT, a blood clot deep inside the leg vein. Why is this dangerous? If undetected, a blood clot can travel to the heart or lungs, causing a pulmonary embolism, leading to breathing failure or sudden death. This is one of the hidden causes of death in older adults with limited mobility. Warning signs of DVT: cramps in one leg only, with a heavy, deep ache, mild swelling, warmth, or redness in the leg, pain that doesn't go away even after rest. What to do? Seek medical attention immediately, especially if you've been inactive, had recent surgery, or are bedridden. Ask your doctor for a Doppler ultrasound of the deep veins. If diagnosed with DVT, you'll receive proper anticoagulant medication. 6. Peripheral artery disease, PAD, leg artery blockage. Do you get cramps when walking a short distance, and every few dozen steps your leg aches sharply but stops after resting, only to start again when you walk? This is a classic sign of peripheral artery disease, PAD. PAD is common in people who have high blood pressure or diabetes for many years, have a history of smoking, even if they quit long ago, have high cholesterol. When arteries supplying blood to the legs narrow or get blocked, muscles don't receive enough oxygen, leading to cramps during movement. Stethoscope: what to do if you suspect PAD. Visit a vascular specialist and request an ABI test, ankle brachial index, compares arm and leg blood pressure. Get a leg artery ultrasound or CT angiogram if needed. Early treatment can relieve pain and prevent tissue death or amputation. Don't let cramps after walking go on for months. PAD gets harder to treat over time. 7. Underlying medical conditions: cancer, liver disease, spine disorders. If you've tried everything, diet, supplements, massage, stretching, but the cramps persist for months, it might be due to a hidden illness in the body. Possible causes of chronic cramps: cancer, especially blood, liver, kidney, disrupts metabolism and electrolyte balance. Cirrhosis or chronic liver disease affects mineral regulation. Lumbar spinal stenosis compresses nerves controlling the legs, triggering spasms. Neurological or autoimmune diseases impair nerve-to-muscle signaling. When to seek deeper medical evaluation: cramps last over a month despite healthy habits, accompanied by weight loss, insomnia, leg numbness, or lower back pain. You have a history of hepatitis, fatty liver, arthritis, lupus, or cancer treatment. Don't hesitate to speak openly with your doctor. Doctor, I feel my cramps might be more than just age. Could you run a thorough check for me? The 3-minute bedtime formula, a small habit with big results. As promised, here's the simple but powerful habit that has helped many seniors reduce nighttime cramps. How to do it: hourglass not done when, every night before bed. Duration: about 3 minutes. 3 easy steps. 1. Calf stretch, 1 minute. Sit on the bed, extend one leg, wrap a towel around the ball of your foot, and gently pull the foot toward your face. Hold for 30 seconds, then switch legs. 2. Massage calves and soles, 1 minute. Rub from heel to calf using circular motions to warm up the muscles. Massage the soles and gently press the center of the foot. 3. Drink a warm salt/electrolyte drink, 1 minute. Mix 1/8 teaspoon sea salt plus 3 to 4 drops lemon juice plus 100 milliliters warm water. This helps balance electrolytes and keeps the body warm overnight. After doing this for just 2 weeks, most of my patients reported significantly fewer cramps and deeper, more restful sleep. Final thoughts: understanding cramps to end the suffering. Dear viewer, maybe you've grown used to enduring the nightly pain, sleeping in guarded positions, waking up 3 to 4 times each night from calf cramps. But now, knowing the causes and solutions, you no longer have to suffer in silence. If this video helped you understand your condition, please leave a comment below. And don't forget to subscribe to my channel so I can continue sharing practical, down-to-earth health advice for aging well. I post new videos weekly, covering joint pain, sleep, heart health, digestion, and more. Everything seniors truly need. Tap the notification bell because you deserve to live strong, sleep well, and enjoy your golden years in peace.